What's up, everybody? I'm David. I'm your host of Highway to Health podcast series. Thank you for being here. For anybody who's joined, you know that this podcast is meant for the people, for the organizations that are committed to improving patient access, patient experience, and patient outcomes. There's a lot that goes into that, and we've had the honor of having some of the best in the industry on. Today's no different. You're going to be excited to hear from Carrie Perez. She's the Chief Marketing Officer of AMN Healthcare, and I can't think of a greater need, a greater fit for this podcast because they're delivering on some really big challenges for the healthcare industry, and we're going to tap into that expertise today. We're going to learn a lot, and I appreciate you being here. Carrie, welcome to Highway to Health.
Thank you so much, David.
Yeah.
Great to be here.
So, you know by now, favorite question to ask, healthy habit. What are we doing? How are we stay consistent maintaining physical and mental well-being?
So important, and I like to think of it as mindset and motivation. So I actually have written mantras on my bathroom mirror that it says, you never regret it when it's done. So to kind of motivate you on those days when you're just like, oh man, a nap sounds really good. And and also consistency equals progress.
That's good.
And so it's just kind of like, hey, even though those days you might get off track, like get back on, don't go too far. And then I hate to give a plug, for a product, but kind of love my Aura ring.
Oh yeah?
Yeah, so really good at, tracking my sleep and tracking my steps. And so just making sure I'm kind of hitting my steps and also thinking that being healthy and being able to move my body, being grateful for that, it's a luxury and not a chore.
Yeah, I agree with that. I had somebody on the podcast recently who does a lot of work with disability, those with disabilities. And he said, David, they wouldn't give up everything to have what you have. They'd give up everything for one opportunity to ride a bike, one opportunity to get a workout in. And that's always stuck with me because we have a lot to be grateful for.
So true.
And we're doing better than we deserve in most of the cases. Aura ring, knowledge is power.
Yeah, exactly.
Understanding how you're sleeping, having that access to information allows you to change your behavior, build some habits. And so I've heard a lot of great things. I'm not a big watch guy.
Yeah.
So I've never gotten into the Apple Watch or iWatch.
That was my whole thing. I just hated sleeping with it. I hated charging it. It's very easy. And I guess I should get some, referral dollars for promoting it.
Give your Venmo or your Cash App.
Exactly.
Let them pay you. It almost looks like my wedding ring. I should just swap it out.
Yeah, I've seen people do that, in fact. Yeah.
I don't know if my wife would like it. So, AMN Healthcare, Chief Marketing Officer. We have done a lot of conversation on this podcast about staffing shortages, nursing shortages, the impact it's having on the healthcare industry, the impact it has on the patient, and we're all patients. And so this is a perfect opportunity. You've been in this space for a while. You've seen things change. You've seen expectations change. The way people engage has evolved. Tell us a little bit about what you've seen, and then most recently with, not a transition, but you in a new role here recently. What has been the biggest, wow, these things have changed? What are providers, what are systems expecting these days that maybe they weren't expecting 5-10 years ago?
Well, you mentioned you've talked about the shortage a lot, but I do want to start with just really getting into the mindset of health systems as well as providers and clinicians and sort of what they're facing on a day-to-day basis, just to kind of help explain what has changed. So, hospital margins are thin, the 60% of their costs are labor costs, and yet nurse managers are saying that they are still understaffed. And the nurses themselves are feeling burnt out.
Oh, yeah.
In fact, I think in one of the surveys that we do, our RN survey every year, the nurses are saying that the number one thing that they're going to focus on in 2024 is actually their well-being. It is taking time for their health, finding that work-life balance, and finding that flexibility. So all that to say, they're in a different mindset that I feel like we need to have empathy for.
Yep.
They are stressed, they are having hard days, and so their expectations are also changing for the partnerships such as AMN. Oh yeah. So they want things like transparency and control after going through hardships during COVID. You do feel kind of out of control. They want that flexibility both in what you can offer them and in their day-to-day. And they want it to be, you to be easy to work with. There's just so many other challenges, so many things that don't have interoperability that they don't need one other point solution or salesperson or marketing message. that is just going to disrupt their day and not actually ease them. Provide ease for them. And then I think they just want to be known, because, to know them is to be able to predict their needs. And so that personalization sort of really matters. And so I think that's kind of the key things with transparency and control, flexibility, ease of doing business, and that sort of personalization is what they're looking for now in a partner.
That's hard to do, though. I mean, with an organization as big and as broad and as deep as AMN Healthcare, education's important, right? Mm-hmm. They need to know how you can help, but you can't be a burden to their day.
Right.
Your solutions can't be hard to adapt or adopt. Mm-hmm. And so that puts all of our service providers in a predicament.
Yeah.
How can we educate without overburdening? Mm-hmm. And so how do you strike that balance?
Yeah, I mean, I think that is where your kind of data and technology meets that human component. So if we're able to use a lot of insights to find out what a person is motivated by, that's very key. So one of the examples on our the candidate side, for instance, you've got a myriad of different types of people who want to do nursing. So really understanding specifically about that individual, using insights that you can marry up against a lot of external factors, you can kind of get to know that this millennial who is based in a city is very interested actually in philanthropy. And so what's going to motivate them to work assignment or to be happy or to be fulfilled might be very different from a new grad who is really interested in paying off their college loans.
Right.
So those are the types of insights that you want to leverage without them maybe even having to explicitly tell you. So you can kind of meet them where they're at and really talk to them about what the advantages are that they can experience on the candidate side. On the client side, that's a little bit of a different story. You really starts with kind of listening, and being able to have those face-to-face conversations. And one of the things you and I were talking about, it's not about you. It's about them.
Yeah.
Right? And there's so many different problems that they are facing. They have to choose where to start because they also don't have a lot of resources to do that. So listening first and then tailoring your message second to help them even know what they might not have known just on that first initial meeting.
Yeah. Understanding your customers is it's got to be the biggest thing we do, because you can't solve everything at once. Your customers are going to have to prioritize, especially when margins are as tight as they are with the client side of our business. So you have to be an active listener.
Oh, yeah.
And you can't try to shoehorn something into a provider, because it's got to fit timing, it's got to fit priority, because they only have a finite number of dollars to work with.
Right. And it can sound, trite, of course, listen to your customers, but it can be forgotten.
Yeah.
And so that constant reminder, and I worked at Amazon for a little bit, and I think everybody knows that Bezos had the axiom of bring a chair into the room, and that's your customer, and so they're always there, and to always think of them.
Okay.
And so I think that is just very important to get that voice of that customer frequently, and adapt your solutions or even your messaging to make sure that it resonates.
I'm going to put you on the spot here.
Yeah.
This isn't something we prepped on.
All right, let's do it.
But you brought up Amazon.
Mm-hmm.
All right. To get where we want to go in healthcare, we have to take some direction and some lessons learned from outside of healthcare,
right,
and bring them in. When I think of the best customer experience, the best vendor partnerships, I think of Amazon. Mm-hmm. I think of Chick-fil-A. I think of Target. I think of some of these brands that we depend on in our personal lives that just deliver every time. What are some things that maybe you learned personally, or maybe some things that you've just witnessed and experienced holistically, that if we could start adding to the healthcare industry more and more, it would help our patients, it would help our providers, it would build stronger relationships with the vendors and the partners, with the systems and the candidates?
Yeah. Well, their whole principle is being customer obsessed. And they live and die by how they act, and culturally by their leadership principles that are really focused around that. And so I think there is an element of bringing that into everyday decision making, because it's one thing in a room to talk about strategy,
right,
and then it's another thing when it comes down to making the decision. people can tend to still think about the bottom line when, you really should just be kind of thinking about what's best for my customer. So I think infusing that a little bit more, and then just the access to data that they have is like unreal, right?
Yeah, that helps.
And just like the ability to do so many different like permutations, I'm sure all the like data, regression to just get to know like every instance what you're thinking. That could be, healthcare might be a little bit far off, and hey, frankly, sometimes that might be a little creepy. But I just think that ability to kind of predict needs and sometimes show you what you don't even know that you want.
That's a good point. I can think of many examples where I'm like, oh, I didn't even remember I needed that, but thanks for showing it to me.
Yeah.
Amazon's great. It's cool that you have
and
that experience
they're efficient,
too.
And I think there is a big parallel with that in healthcare too, especially as we think about nurses and the burnout and the shortage. Is how do you make things more efficient at the point of care?
Yeah.
And a lot of the technology that can be used to help them just do that last mile decision making. That is a term right from Amazon too. That last mile delivery.
Yep.
All the logistics leading up to getting the product a mile from your house is, all the hard stuff, and then that's like the customer care that's getting it that final mile that you can think about, that final patient care decision making.
I think of those experiences as frictionless, and there's too much friction in healthcare right now, which goes towards burnout, which goes towards a lack of a patient experience, even patient access. And so there's too much friction in healthcare. We've got to start avoiding a lot of those things so that we can get to where we want to go.
Yep.
So how have you done it, right? Big fan of AMN. I learn from you guys literally every day. And you've become this educator, this authority in this space. How have you done it? How's your team done it?
Yeah. Well, I think we share a mutual passion probably for thought leadership and being able to take something that can feel maybe cold on a leave behind or on a email marketing message. Very important, I will still say that. But to be able to actually interact with the community, get in front of an audience, show your personality as well as your expertise, I think is very critical. So, we've adjusted to do, more podcasts, more short form videos. Yeah. In addition, we've been around for 40 years and we have, I think, a couple decades worth of bespoke surveys that we do. I mentioned the RN Health survey, a physician wait time survey, and you can just become a little bit of at least credible figure that your customers will come to want to speak with you about because they know that you have been taking the time to actually care about their industry, know it more, and be part of the solution.
And what I've really respected about your strategy, not only in the marketing and education piece, but really just the structure of AMN, is you're going in and bringing in talent that have lived it, that have breathed it, that have experienced these challenges from your leadership on down.
Yeah, definitely. I mean, we've got a whole clinical team that are former nurses or allied professionals or doctors who are there to help inform, people who aren't. Right. And what are they actually feeling and experiencing, or that's not going to resonate. Also being there for our healthcare professionals 24/7 if they ever have, a feeling of that they need some help on the job. And then in addition, we are a public company, which is, has some great benefits too. And we have some wonderful people on our board, former CEOs of hospitals, former, U.S. Surgeon Generals that are constantly having the mindset of what it's like actually being in the industry to help us steer our ship and really make sure that it is about patient care.
Yeah.
You can, going back to the Amazon example, you can get kind of like lost in just the mechanics of things. But one of the most, I think, compelling stories I can recall is when our former CEO, she came to work on a Monday and her father had just had an episode and ended up in the hospital. And it still gives me chills actually thinking about it. And she found out the nurse taking care of her dad was a travel nurse.
Really?
Yeah, and so it just like brings it home to really think about what it means to think about our caregivers and ultimately what it means for our patients.
Yep.
Yeah.
That's one of the advantages we have in healthcare is we're never too far away from our purpose because we're all patients.
Yeah.
And we're all caregivers. And the work that you guys do directly impacts the quality of that access to care and experience, which is obviously important with the outcomes. And so having those people on your team even further connects you to the end result and the overall purpose of what you guys are doing every day, which has got to drive motivation. It's got to drive focus for the overall organization.
It definitely does. And I don't know if we spoke to it directly, but AMN, and not to do a plug, but just to give some context, additional context, workforce staffing, planning, engagement, technology, everything kind of from soup to nuts of predicting the needs that you have as an organization, to finding the supply, to giving you tools to do it, on your own, and sort of everything in between, travel, permanent, per diem staff, just a little bit of extra context of what AMN's all about.
That's something that, as I've had these conversations, one of the things that has come up is, man, but the travel nurses are so expensive for the systems. And I don't know if they can continue to afford this model or scale this model. And, sometimes it can be, however much more expensive than a local nurse. First of all, is that true? Is it not true? And then what have you seen across your customer base? Because this is a growing area and it's a very competitive space. Also, you guys have a lot of competitors, which tells me that there's a need.
Yeah.
There's a hole here that a lot of people are trying to fill. But when others say, well, it's too expensive, it's not scalable, that can't be true either. What's the reality here?
Right. COVID was costly for everybody. And I think there is a myth that agencies were jacking up prices because they could. It was a supply-demand environment. Nurses were going and putting their lives on the line every single day. And it was basically a supply and demand, ratio of what they were willing to be paid in order to go and take an assignment. But since
also
then,
increase in risk for those, right? So
yes, exactly. And how do you put a price on that?
Exactly.
Right. And going into ground zero, in New York or something, and not being able to then interact with family or anything outside of that, really, that also gives me chills of just people being able to do that. But since then, there is, at least in particular with AMN, we have been part of the solution we're hoping with our clients. We've seen, bill rates, come down 20 to 40% back to almost normalized levels. So it's fair to say that things were expensive. They're expensive for everyone, but those costs have certainly come down. But in addition, there's the other side of it too, of what it costs to not have staff, or what it costs to try and actually have a full FTE, workforce. To have the flexibility to know when you actually should have just some contingent labor because it's flu season and you're not going to need all those people, to also the cost of what it means to have high turnover. So I think, a stat is for every 1% turnover, it actually costs $263,000 per 1% turnover. That's expensive.
1% turnover.
Yeah.
Wow.
And that's huge. With people being burnt out, you can guarantee that's happening. And there's been a mass exodus since COVID of people who maybe were going to stay on a few more years saying, nah, I'm done. I'm out of this.
Yep. Yeah, I don't think that's what the other side of the coin really understands, is that you can't just have a full bench all the time for a lot of reasons. One of them being, where are they? Right? Are they even available locally? Probably not. And then secondly, you can't just have a full bench and hope that you have the census or the population that demands that, that volume of nurses on staff. And so these systems have to play this game of balance, because it's costly either way. At least this way gives them some flexibility and some freedom.
Exactly. And even if they probably could have a full staff, they probably can't, actually, to your point of just, there's only so many OR nurses in, rural Oklahoma. You're going to have to find them in other places. Yeah,
it only makes sense. Supply and demand. And it's that way. I mean, we talked about other industries. It's that way in other industries too.
And I think the other important part of it is a two-market sort of system. Candidates have choice, right? nurses they've got their own desires for flexibility and working different hours or different types of shifts or being part of new care models. There's a big virtual option out there. There's people who now don't want to work in acute care settings. So there's a lot of moving targets, and what they care about matters, based off of the system that's set up for them too.
Yeah, I mean, if you look at this whole ecosystem, you have changes of expectations from the candidate side of things. You have a change of expectations from the healthcare system side of things. They've got to find a way to match. That's why it's so important for vendor partners and solution partners to meet both of these communities, all of these communities, where they're at.
Right.
And you see it now. This younger generation that's coming into the workforce, they want flexibility, they want freedom, they want experience. And when you have that coming from your primary workforce pool, candidate pool, then you have to find a way to give them that experience and meet that expectation while being fully staffed.
Yeah, and sometimes it actually means more staff. If clinicians are interested in maybe working 8-hour shifts or a 4-hour shift, you now might need to hire 3 nurses to do that job of what was a 1 12-hour shift before. So that just goes to show too that we're still in that shortage.
Yeah, we have to find this alignment between all the people involved, because at the end of the day, what we've got to come back to is there are patients that need access to care. There are patients that need a great experience, and then we've got to make sure that these outcomes stay where they are and get better along the way. All the other things are just distractions. We've got to put it behind us, find a solution,
right? And
it doesn't matter if they're traditional or not.
Exactly.
Let's just meet these patients where they have to be. So getting back to your role as a CMO, these executives that are looking for answers and solutions to the problems, the challenges that they face every day, they have a lot of different places they can go to learn. They have a lot of different vendors that they could partner with, but they're busy. How do you get in front of them, other than the podcast and things? Is there an opportunity to bring them in and give them an opportunity to be a position themselves as a thought leader, give them an opportunity to teach others that sit in a similar role as them something new and something interesting?
Yeah, that is a great call out, because I think customer advisory boards are really critical, but not just in the lens where it's like, hey, help my company figure out if we're doing a good job. It's like, no, part of it is we want to help you talk to your peers and understand the challenges that they're facing and the solutions that they're coming up with. And we just actually relaunched a new advisory board, and we're looking for different types of constituents. So we want a CIO, and we want a chief medical officer. We want a VP of a talent acquisition, along with a CNO. That's important too, because of all the various stakeholders that are now making decisions in an organization. So what we had once seen, as I might have mentioned, was a CNO being the primary kind of consumer or buyer. Now you have a CFO heavily involved. Looking, of course, at just we're in the red. How do we get back in the black? And then you have a CIO who is like, cybersecurity is my number one focus, and actually healthcare is like the number one target. So it's a very interesting place for them to come together and maybe even solution on how do they make decisions now? They're going through their own metamorphosis.
That's who they want to learn from anyway. And if we as a vendor partner can act as a connector of those experts, then credibility comes organically. But let's get the peers talking to each other and helping each other, because just like for the same reason you have these executives that have lived in that seat, it breeds credibility and it breeds true education. And so it's great that you guys are connecting those leaders in that way. What do you see as like the next trend, like the next thing that's coming down the pipe, whether it's meeting these systems and these clients where they are, or meeting these candidates where they are?
I think the next thing coming down is how we work in a different landscape that has now come out of, COVID. So I think a couple things that I think of there are like consolidation, both vertically and horizontally within the healthcare landscape. Yeah. So there's hospitals buying hospitals. There are, digital platforms buying other digital platforms. There is, Epic opening up their Partners and Pals program. So it's just, you're not in Kansas anymore. So I think it's figuring out what do things look like as these point solutions become platforms, and as new entrants into the market start to bleed into each other's spaces. What does this co-opetition sort of look like? And how do you really show value to an organization and recognize that you don't also have to have everything, and you probably can't. So I think there's going to be a lot more partnerships that you'll see, and a lot more ways to provide that seamless, I hate to use so many jargon, but that seamless interoperability. So you are part of the easy button. And again, not thinking it's about you, but how do you fit into, their system?
I think collaboration is going to be the next phase of this healthcare journey, this industry journey that we're on, because I was at, I think it was Vive last year, and the Philips CEO, who was brand new to Philips, got on stage, and to a room full of vendors, to a room full of exhibitors, he said, none of y'all are going to fix healthcare. And he said, because none of y'all talk to each other, none of y'all collaborate, none of y'all partner, y'all all see each other as competitors. And he said, if Philips can't solve healthcare by themselves, by ourselves, y'all can't either.
Right.
And so this co-opetition, I like that term, I'm going to steal it, is going to be really important.
Yeah.
We've got to start working together. I say it too much, but it's going to take a village.
It will, and I do think because COVID was so painful, and I can't believe we're still talking about it, but it was a seismic shift, right?
Yeah.
It really did force maybe some of the microscope view on the structural, I guess, problems that you could maybe get away with not focusing on, but now you have to. And so it does breed, I think, we must. There's no other choice but to try and fix this. And then even with consolidation and with the, access to data, it does help to, another buzzword, the democratization of kind of information just puts things at your fingertips a bit more.
I think COVID helped us focus on what's truly important.
Yeah.
And it was like, we've got to get care to the people who need care. And we got to keep them alive. We got to make sure the outcome's what we want it to be.
Like, we all love red tape, but maybe,
exactly. But you know what? A telehealth visit, we'll approve it.
Yeah, exactly. That's so true too. Just with the extension of being able to have that be coded and paid for.
Exactly.
That's so important. Yeah.
Yeah, just cut the BS, cut the red tape, and let's get the providers, the clinicians, what they need so they can get the patients what they need.
Right.
And then move on.
The other thing too is, I know it is so important to talk about technology, but maybe another trend too is just like the overusage of it.
Oh yeah.
And the over reliance on it that makes things become impersonal. And I think you might even start to see, you'll continue to see the pendulum move towards how do we get things more efficient. But I think you can already start to see people being like, yeah, AI is cool. And also, like, what is AI? I say I know it, but like you hear people be like, we need to have AI. It's like, well, what does that mean to you actually?
Yeah, exactly.
And so, as marketers, it can be a great tool to, help kind of tweak some content and all that. But I think the trend is going to be making sure you're authentic, that you are empathetic, and that you are having a relatable message. That's not just another, thing that sounds like a bot created it.
Exactly. Yeah, I think authenticity is going to become the new creativity.
Ooh, I like that. I'm stealing that.
All right, deal.
Yeah.
We're even now.
Okay.
Because, anybody can type a prompt these days.
Right.
It takes a little bit of courage, a little bit of knowledge to do what you're doing.
Oh, thanks.
If our listeners could walk away, and we have marketers that listen, we have provider health systems that listen, we have education systems that listen. you pick your community, but if they could walk away understanding one thing from our conversation, something that they'll tell their parents about or their wife about when they get home, what would that be?
I think that remember we're all people, and that it maybe goes back to that last sentence of just authenticity is key and empathy is key. We have all gone through hard things, and it is important to keep that in the forefront of how we're interacting with each other.
Yep.
Is I think the main thing, as just like make sure that you are meeting human-centered design and technology.
Well said. Who's going to win the election? I'm just kidding. We're not going to go there. We're not going to go there. Thank you so much for being here.
Thank you. It was awesome.
And appreciate it.
Great view, by the way.
Yeah. For those that tuned in, thank you. And we're doing our best here to educate you, but also just collaborate with you on where we are in healthcare today, the challenges that we're experiencing, and how do we get to where we want to go. We say it all the time, but it's going to take a village. And we have to align with the changing expectations, the changing vision that is coming from our patients, our providers, and everybody included in this journey. So I welcome you to come on and share your expertise and your knowledge, your journey in this industry. Come on back for the next episode too. We'll talk to you soon. Thank you.